So hello everybody, welcome to this webinar on the financial resilience of support services. Is Europe doing enough? Before passing the floor to Luke to do some welcoming remarks, and then to start I will share with you some technical points. The webinar will be recorded and made available after the event. Your microphone will be muted to ensure that we can have a quality session. If you have any questions, and we're going to try and be interactive as well, please use the Q&A button on the control bar at the bottom of your screen, or feel free to put your comments in the chat box. And then later on throughout the event, I will try and bring them up if possible. So if you have any questions, Q&A or the chat box. You can also activate closed captioning by clicking on the closed caption button at the lower part of your screen on the Zoom panel. So closed captioning, which is speech to text in real time. That's it for me for now. Luke, the floor is yours.
Thank you very much, Thomas. Indeed, I'm Luc Zeldero, Secretary General of ESPD. Welcome at this important webinar, a webinar on financial resilience of our sector. And of course, the key question is, could, should, or must Europe do more and better in supporting our sector? And why is it important to have this debate? It is important because financial resilience and financial sustainability is key. It is key for the continuity of our services. It is essential if we want to provide a high quality of services. And of course, it is also very important to guarantee stability to our workforce, to the people working in our organizations, and to be able to offer them interesting career paths and possibilities to further develop their skills and knowledge and know-how. And indeed, it also is crucial to make change and innovation possible in our field. Looking at the cost structure of social services, we know that 75 to 90% of the costs are staff costs. So financial instability is immediately eroding working conditions and the good relation with the people working in these services. So all these elements make that a webinar on financial resilience is very important for our sector, because our sector is still recovering from the financial crisis, 2008, 2011. Then many savings cuts in the social spending were implemented by the authorities. And for many of you, many colleagues from across the European continent, we are still not at the level before the financial crisis. And now we have another layer of issues and challenges, and that is brought to us by COVID-19, by the pandemic in which we are now. Some of you experienced interruption of payments by authorities. Others saw their subsidies decreasing. Many of you saw sponsoring going down, international sponsoring by international organizations, by businesses, by local communities. It decreased for many of you. And on top of that, we saw an increase of the costs. We saw an increase of the costs because many social service providers were creative and active and committed to their service users and went digital, implemented working methods which are to a large extent new and which required investment in further development of staff and training, but also in hardware and software to make it possible to support people in a qualitative way. This webinar is about where are we when looking into the financial resilience of our sector, and what are the challenges? What are the challenges, and what could the European level do to help our sector, to empower our sector? And of course, this debate here today is directly linked to the development of social policies at European level. At Council of Europe level, indeed, important discussions are organized. And with regard to the European Union, we will have next week, and please don't miss the Policy Café on the 4th of March in the morning. Then we will introduce the new European Disability Strategy, which will be launched by the Commission one day before. On the 3rd of March, they launched the European Disability Strategy. ESPD has a Policy Café on the new disability strategy on the 4th of March in the morning. And as you all know, or as most of you know, we are also actively involved in the recovery and resilience programs that are set up by the European Union and by the member states. So it is the right moment, I think, to discuss financial issues, and it is absolutely essential to make sure that our sector is correctly financed if we want to provide up-to-date, innovative, personalized, effective services. So I wish you a very interesting afternoon, and I would already like to thank all the speakers because they will bring a pan-European overview of the challenges, and without any doubt also will contribute to developing a comprehensive view on the way forward. So thank you for being with us. Thomas, we're all yours.
Thank you very much, Luke, for that introduction, setting the scene, I think, very, very well. So for the rest of the 1 hour and 20 minutes we have, we will be divided into two different sessions. The first, we will hear from Sigrid Hand, who has been doing some research for us on the short-term impact of the COVID pandemic on the resilience of the sector. So there will be a first 10-minute overview by Sigrid on that. And afterwards, we will go around Europe in the different countries, speak to service providers on the ground, and they will introduce to us what is the financial situation in the countries in terms of their services, and also what support are they getting from the state or others. So we're trying to mix, let's say, a general overview and study to real life experiences on the ground by services sector. And hopefully with this sort of input, we can try and bring to light some of the issues that we have as a sector. So before that, I will introduce Sigrid Hand to you. Sigrid, you have 10 minutes. Thank you.
Thank you very much, Thomas, for this introduction. And this is the presentation. I'm afraid we will have to do with this screen because I have some technical issues. Sorry for that. So first of all, thank you very much for the opportunity to present our research. We were following the research question: how did the COVID-19 pandemic affect the providers of social support services, the scope and quality of the services, and the workforce in the sector? Our focus was on the period between February and June 2020. The start of the COVID-19 pandemic lies back a year now, and so much has happened since then. In our opinion, it is still important to look at the first phase because it exposed the weaknesses in the sector. Also, the decisions that were made still impact our situation today. The countries that we looked at were Spain, Germany, Romania, Finland, and Ireland. Our research entailed literature review, an analysis of statistical data, and expert interviews. I will now present the main insights from our research. I will start with the governance of social support services. Which decisions were made concerning social support services? In all 5 countries, the governments reacted to the spreading of the COVID-19 virus by applying laws reserved to a state of exception. They were used to restrict personal freedom, for example, mobility, regulate the closing of institutions, provide social welfare payments, and define economic responses to the crisis caused by the COVID-19 pandemic. The emergency laws either regulated directly the healthcare and social services or served as the basis for further enactments. These were issued as the understanding of the situation evolved. The main objective was to continue the provision of health and social support services as far as possible. Many of these measures were targeting the workforce as the most essential component in service provision, for example, issuing a ban on holidays or mandating overtime work of care staff. From the beginning, the providers of services for persons with disabilities had to address pressing issues. They had to acquire personal protective equipment, process the ever-changing information on hygiene guidelines and implement them, maintain the funding for services that were cancelled, and find new funding for additional costs of service provision. The COVID-19 pandemic affected the providers very differently. Very broadly speaking, we have two aspects that determined the impact. The first one is the level and differentiation of available services. We have core or basic services, which absolutely have to be provided at a particular site. They cannot be substituted. And then around it, we have different services which are there to cover the particular needs of life of persons with disabilities, sometimes entailing an element of choice. While the operating of care homes continued as a core service, in most cases, daycare centres, sheltered workshops, rehabilitation or leisure activities were closed. In particular, this affected countries where the service landscape is highly differentiated due to relatively good funding and the strong element of choice in the system. Take, for example, Germany. There were extensive guarantees and high levels of additional funding to mitigate the effects of the COVID-19 pandemic. But in the highly differentiated service landscape, the support measures did not cover all kinds of providers. The second one is the public-private divide in the provision of social support services. In countries where this divide was strong, it is also reflected in the COVID-19 measures. Public providers could rely more or less on the continuity of funding, personal protective equipment was available more easily to them, or they had access to supplementary allowances to compensate for additional costs in service provision. In a country with a less developed service infrastructure like Romania, the operating of public service providers was further ensured at a lower level of activity, but the NGOs did not have access to these additional resources and were struggling to carry on with their activities. Now let's come to the scope and quality of services. In the situation where many social support services for persons with disabilities were discontinued, there was a lack of personal contact. Therefore, the communication was increased or attempts were made to digitalize the services. But persons with disabilities or their families did not always have access to the necessary devices or did not possess the ICT skills. And in many cases, digital services could not substitute the personal contacts. So we had a situation where services needs were and are still building up, and services could not react flexibly to the changing needs of persons with disabilities. Also, these substitution services were designed and were kept running under very difficult circumstances. Therefore, the providers did not have the resources for quality assurance, and they were lacking suitable guidelines and experiences in this field. We should also not forget the services that continued existing in the usual format, just at a reduced level. This concerns, for example, the complex composition of services in a care home setting. In many cases, leisure activities that are meant to activate people were discontinued. If these changes affected persons with disabilities, it was difficult to find it out, since in some countries the mandatory inspections were suspended during the first phase of the COVID-19 pandemic and visits by families were restricted. Concerning the workforce, in all 5 countries, statistical data showed for the healthcare, residential care and social work sectors that the number of persons employed there decreased, the number of unemployed persons rose, and the number of vacancies decreased, all indicators for a considerable stress on labour markets. As many employers were struggling in this situation, governments reinforced their short-time work compensation schemes to recompense workers for their lost income. This instrument had not been relevant for the health and social care sectors before the COVID-19 pandemic, but was extensively used starting from March, April 2020 as a measure to retain the service infrastructure for the times to come. That means not to lose the workforce in the sector. Therefore, I would like to show you here a graph of Spain detailing the number of persons receiving compensation from the temporary labor force adjustment plan. We see that very few persons used the instrument in January and February 2020, but there was a strong increase in March. The numbers increased even further in April and May as the COVID-19 pandemic peaked and the lockdown measures started to affect the employment. We see the highest figures in the period for short-time employment in healthcare, the grey columns. But we need to take into account that it also has the highest number of employees and the very differentiated service structure, including, for example, also dental practices and the like. The number of reduced hours employees remained relatively low compared to the healthcare in residential care. These are the dark blue columns. Here we have a high share of activities, for example, care homes, which were considered core activities and retained their labor force. But when we look at social work activities again, a high number of workers were affected again. Also for Germany, the same kind of data are available and the trends are very similar, as you can see from this graph. If the services were transformed, this required a lot of flexibility from workers, but they did not always have the kind of skills for carrying out the new tasks. So there was a shortage of personal protective equipment, staff shortages were aggravated, and workers had to continuously perform tasks beyond their daily routines. It is not surprising that there was a lot of pressure on care workers that resulted in their exhaustion. Against this background of our research findings, I would like to come back to the topic of our webinar today, resilience of social support services. I think that you would agree that the sector was facing challenges already before the COVID-19 pandemic. The main issues that we were discussing back then were how to extend social support services to satisfy the growing demand as a result of demographic developments, the need to reconcile family life and work, as well as maintain the care infrastructure also outside the cities. We were also thinking how to ensure the quality of these services. Here we were considering both the standards of service provision as well as the need to provide social support services that are required by the users or their families. And we were concerned with making sure that care professions and the care sector are attractive for workers and that they are able to remain in their jobs for longer. There was the need to address the skills and working conditions of the workforce. So the sector was already seeking to address mid and long-term challenges in a coordinated manner. With the COVID-19 pandemic, this path took an unexpected turn. Our research showed that the infrastructure of social support services deteriorated as segments of the sector had to be closed down. In the segments that remained open, the level of services decreased, for example, with less face-to-face services. Also, measures had to be taken to prevent the spreading of the COVID-19 virus among the most vulnerable groups. This raised concerns about not being able to observe the fundamental principles of service provision, proximity to the user, the inclusion of persons with disabilities into all spheres of social life, supporting their autonomy in different fields of everyday life, and developing it further to enhance their independence. Instead, across the involved countries, and this is probably something that also you can relate to in your context, we observed that safe distance emerged as a guiding principle in service provision, determining the continuance of services and leading to a large-scale increase in seclusion. Of course, this has curtailed the autonomy and independence of persons with disabilities.
Sigrid, you have 1 minute. You have 1 minute left.
Okay. And we also saw that the working conditions worsened considerably. Within this framework, we need to ask ourselves, how will these developments affect the resilience of social support services sector that is already quite fragile? Resilience is commonly understood as the ability of an individual, organization, economy, or society to recover from difficulties and regain their vigor. Research at the level of individuals has shown that withstanding stressful and adverse situations and recovering from them requires personal strength. At the same time, it is important to be able to rely on family, neighbors, or religious communities, the social support structure. Along the same lines, we cannot demand from organizations, in this case the service providers, that in a situation of large-scale external shocks, they need to be able to retain their operations just based on their own resources. Especially considering that many of them are operating in a heavily regulated environment and are non-profit entities. Therefore, the social support services sector needs support in their recovery, especially as this recovery will lay the foundation for how we're going to take care of the most vulnerable in our society in the coming years. This entails funding, but also societal dialogue about the fundamental principles of service provision. We also need to analyze which parts of the social support services fared well during the COVID-19 pandemic and which parts suffered most. And we need to assess the experiences with changes in the provision of social support services. Which were the good experiences that we can learn from, and which situations do we wish to avoid in the future, just as Luke was saying earlier, so that we can develop up-to-date and innovative services. This reflection part is crucial since the notion of resilience also suggests a forward-looking planning component, looking beyond the current conditions, keeping focused on the times ahead as a point of orientation and motivation. And therefore, I am glad that the ASPG is bringing this reflection and planning together in the webinar today, as I have understood it, also in their activities throughout 2021. Thank you.
Thank you very much for that. I think quite a clear overview highlighting to a certain extent what we already knew, but putting it into real figures and real data, which is extremely important. We will make sure that this research is shared after this event or as soon as possible to everybody. Now I will move on, and if there are any questions for Sigrid, please put them in the Q&A and the chat box, and I will try and raise them later. But I also want to make sure that we move on in the discussion. And so now we will focus a bit more on the realities by the providers at national level. I was going to start with Emanuela, but Joanne McCarthy from Disability Federation of Ireland has to leave a bit earlier than first planned. So if it's possible just to switch you two so that Joanne can start earlier, I hope that's okay. And so Joanne, could you tell us a bit about the situation in Ireland, and I will share your slides.
Great, thanks Thomas. Hi everybody, thank you very much for giving me this opportunity to speak today, and also to my colleagues for letting me frog jump the rest of you and to speak. Just to give you some of the background, I suppose when I talk about disability and disability services in Ireland, I think it's really important that we actually understand, or we get it clear, I should say first, who is DFI? I'm sorry, I should say we're an umbrella organisation. We have over 130 member organisations of disability organisations, and we cover all grounds of disability, so physical, sensory, intellectual, and other grounds. We work closely with other umbrella organisations, the Federation of Antibodies and the Not-for-Profit Association, but they are more specialised in either ID, intellectual disability, or physical and sensory. So we're the only broad stroke umbrella organisation in Ireland. Moving on to the next slide, if that's okay, Tom. Thank you. And I suppose before we start about where we are now in the context of COVID, I think that it's really important for me to give you a quick snapshot into where we were, just, I suppose, the historical context in terms of how disability services are funded in Ireland. So I should say that our disability services, our core disability services programme is funded through the Health Service, which is known as the Health Service Executive. And that the 2020 budget that was announced just before the onset of COVID had committed to 2 billion euros into that budget for 2020. I should say that that budget predominantly supports a very small cohort of the population of people with disabilities in Ireland. So according to our most recent census, we have 640,000 people with disabilities who identify as having a disability in Ireland, where this 2 billion, or the Disability Services Programme, provides predominantly residential places to 850 850 or 8,500 people, and day services or activity of services, day service activities to about 26,000 people with disabilities. So you can see a very small cohort of the disabled population in Ireland benefit from the disability services programme, from that 2 billion. So what we know from the evidence, from the investment, that personal assistance, home supports, so those sort of much more person-centered services that enable a person to live independently in their own home, they garner about 8% of that 2 billion will go to fund that cohort. And also 70% of these services, that's all the services that are delivered on behalf of the state through the 2 billion, 70% of that is done through the voluntary sector. So that's just to kind of give you a snapshot of the kind of reality of what we mean by disability services in Ireland. Next slide, please, Tom. And this is just this is just a slide that has been used to kind of capture that in 2017, and they're building that up year on year to demonstrate just what they see are the core programs in terms of delivering supports and services to people with disabilities in Ireland. Next slide, please. I would think that even before COVID, we would have still been reeling from the impact of the recession. There was, I'd say the summer just before COVID commenced, there was a number of organisations, DFI being one of them, where we made representation to one of the joint Oireachtas committees in our parliament. And in that, it was at a very low estimate, modest estimate, that there was about 40 million deficits being carried across the system of the large organisations. That during the austerity measure, they're gathering in and around 12% of the budget had been cut in the delivery to fund the delivery of the services. And actually, ironically, just the January, just before I suppose the COVID pandemic really took hold, an additional 1% austerity measure had been applied to the funding of all disability services. So not only were we carrying, I suppose, the legacy deficits, but we were also, as far back as 2020, sorry, that should say 2020, there was a 1% cut being applied to the funding. So there was an expectation that the same level of funding would still be delivered with this 1%, with the legacy deficits that were also in place. And that was just to say, many services to people with disabilities fall outside of that, of these services. And I would say, for example, oftentimes, I just gave you an example of people who acquire a disability, maybe due to a road traffic accident, a neurological condition, they actually don't ever get access to this small, very niche 2 billion funded resource of services. They oftentimes end up in older person services or other services that are not appropriate to their location. So I gave an example here. We had 1,400 people under the age of 65 with a disability now living in nursing homes, which are residents of older places. So just to understand that we talk about this 2 billion, and I'm going to give you evidence around this 2 billion, but it's a very small snapshot into the types of services that are currently in play for people with disabilities. Next one, please. That's okay. So, so the impact, so I should just say that it was really timely. So our state, we have been looking at the learnings internally around how we galvanised a response in Ireland to COVID, and our Department of Health had asked the National Economic and Social Council to produce a report around the best learnings, and I'll talk about that later on, and I've used some of that information to inform this. I would also say that DFI and other umbrella organisations across the disability sector, but also across the wider community and voluntary sector, also have been carrying out research into this, and I'll also use that work to inform. Because of the fact that not all organisations are 100% funded in the delivery of their service, a lot of our organisations would be hugely dependent on a co-funded model, where they would bring in self-generated income, oftentimes through fundraising, to deliver disability-specific services. And during the COVID, that model of service was obviously hugely impacted. It is estimated that in wave one alone, that 40% of the income of many of these organisations was depleted. We did a similar survey where we just did a snapshot into 20 of our members to see in the phase one, what was the impact of fundraising on the income that they use to co-fund services. And it showed that 55% of those organisations said that their essential services were in threat because of the drop of fundraising, and that they were estimating just after the first few months that 7 million euros had been wiped out of their fundraising. So that was just for 20 organizations, and that was just for fundraising. So that co-element is really important. And I should say that it is estimated that the HSE, which is the Health Service Executive, put an additional 120 million into disability specific services during the year of 2020 to fund the additional costs associated to COVID. So I'm just trying to give you some earlier, there's just some flavors that you can understand. Next one, if that's okay, Tom, thanks. So we estimate that the cost of the pandemic for the first 6 months, that was April to September, it was 60 million, with a full year cost of 120 million. That was to fund such things as PPE, training for the use of PPE and the extra, I suppose, measures that need to be in place to ensure that you were abiding by the regulations coming down from infection prevention and control, additional staff measures to cover redeployment, because what happened is a lot of services shut down and staff got redeployed, and so there was additional money required for that, and also for absentees due to COVID. I suppose I didn't include it here because I have
2 more minutes.
Okay, great. So during this time, there was no withdrawal of funding from the HSE, so that 2 billion remained steady, even though a lot of services went online, had to pause or had to be redeployed. There was a full commitment from the funder to continue that funding. There was a winter plan put in place. We were really disappointed that the additional costs that were being associated with the delivery and support of people with disabilities around the COVID was not included in the winter plan. But they did reverse the 1% cut that I talked about that they threatened to introduce in 2020. In budget 2021, which we have yet to see the full breakdown, we know there's 100 million extra, additional extra being put into the service plan. Many of that is to bolster the response to the COVID and also to begin to reopen some developments. I would say that there is, we also had a 20 million additional fund given in November to support organisations around strengthening resilience around their ability to deliver services. And that ranged from back office service to looking at new ways and building on the new models that had been developed during COVID when things went online or new models of service were put in place. Also, many of the smaller organisations that only receive a small grant and aid fund from the HSE to deliver their services were able to avail of a 35 million COVID specific community-based resource to support that. So all in all, you can see quite a significant package of supports went in and around the sector because of the fact that we deliver 70% of the services. So any services, it was essential to sustain the capacity of those services. So it needed that level of support. Next slide, if that's okay.
And you have 1 more minute.
Perfect. So just to say what was now needed, I suppose even recognizing that significant package that went in and around the system in order for the system to be able to respond in a dynamic way to the changes and the needs of our sector to keep people with disabilities and their families safe during the recession, they have yet to address the long-standing deficits that are in place. That 40 million plus that's growing. I suppose we also have recently, there was a report leaked where there is an acknowledgement that there is an unsustainability in terms of our sector continuing to deliver services because they don't fund the full cost of service, and that there is an ongoing leakage in terms of the capacity of these organisations to deliver a service. I should also say this word resilience, and it's funny, I'm hearing it everywhere, that the NESC report itself talked about the fact that the resilience of the sector to be able to provide quite a dynamic, and it's celebrated in Ireland that the disability sector did very well to protect people with disabilities and their families, and they responded in really fast and a flexible way. NESC has warned that the capacity of organisations in the disability sector to be able to do that again is hugely compromised because the financial resilience is not there, and that there's a need to address those deficits and to develop a cushion that will enable that flexibility. We're waiting the publication of a Department of Health document that begins to capture, it's called the capacity review, that identifies those core areas where investment needs to be put in place to enable those captions. So I suppose what I will say in 2 seconds to summarize, that gives you a snapshot. As I said, our sector is identified in Ireland as one of the big successes. We protected people with disabilities and their families significantly against the threat. We did it by going online, by changing our model of service and being very responsive. There is an acknowledgement, however, that this is not sustainable, that the resilience within our sector is hugely compromised by the financial deficits and challenges that are there. And that, as Neska said, in order for that resilience to be seen as a feature and to be seen as a resource to be pulled on in future challenges, that they really need to look at the financial viability of our sector in the co-delivery of services and responses. In summary, thank you.
Thank you very much, Joanne. A very thorough overview of the situation. Impressive that you've managed to do so well over the last year, despite having, let's say, suffered from years of damage since 2008. But of course, quite a worrying situation for the more long term. Thank you very much, Joanne. Now I will move on to our next speaker, Emanuela. So going from Northwestern Europe to Southern Europe, to Albania. Emanuela, how is the situation in Albania?
Hello, good afternoon, everyone. Thank you for the possibility. Thomas, you'll tell me 2 minutes before, right? For my timing.
I will do that, yeah.
Do you see my screen?
Yes, we do.
Okay, thank you.
But not in full screen, so if you could do it in full screen.
Let me try. Now? I will have the same problem as Sigrid with 2 screens.
Okay.
But is it visible enough?
It's visible enough.
Okay. And I can move the slides, so I'm fine. So thank you. My name is Emanuela Zaimi. I'm the founder of Down Syndrome Albania Foundation and the current managing director. But since 2019, I live in Vienna, in Austria. So yeah, but today I'll talk about Albania, but maybe finish with a line also about Austria to what I know so far. In terms of, let me start for you to understand what are the numbers of people with disabilities living in Albania. These are official statistics that we get from the Social State Department, and it means that these are only people who are part of the disability benefit scheme. So they get money from the state, like disability allowance or other types of support due to their disability. So here you can see that they are like, there is, beside people, in total people with disabilities, around 7,000 people, there is also those from work invalidity. So we have to, both of them are somehow part of the disability scheme. We have big problems with statistics for people with Down syndrome, with disabilities in Albania. Of course, even more problem with, statistics for each type of disability. But in terms of Albania populations, we are about 2.8 million and 1.1 million live in the capital, in Tirana. So quite a considerable number. Here you will notice that there is personal assistant. I have to make clear that this is not the great concept of personal assistant. This is just a family member of the person with disability who gets, let's say, an additional amount of money as a caregiver, let's say, for the person with disability. Mainly these personal assistants are parents who do not work due to the need to stay with their family members with disabilities. And I'm not sure, but until 1 year ago, I don't know how it's now, we have trying hard, but these personal assistants, they don't get from the state, they are not recognized as paying contributions for social and health care. So let's say their future is also in danger. So some big data on finances on disability in Albania as a percentage of GDP in 2020, 1.4% of the GDP is what goes, let's say, to disability expenses. Now we can see that there has been a general growth in expenditures, but in terms of social protection expenditures, they are not with the same growth, and you'll understand why. So social spending has made up 4.5% of the state budget in 2020 and 4.7% in 2018-2019. Now, the problem is that most of the money, 90% of the money, goes to cash benefits and not to the social care services. We have three types of cash benefit. It is economic aid for those families who are in poor economic conditions. There is the disability benefits, so disability allowance and this assistance money that the caregivers, one of the caregivers gets. And since 2019, we have added the one-time baby bonuses for families that give birth to a child. They get a baby bonus one time, not monthly. So financial data for 4 years, 2016-2020, tells us that the central government spends around 0.2% of its budget on non-cash social protection programs, which is really low. Now, spending for social care services at local level, this is important because local governments have the primary responsibility to deliver social care services. Since 2015, we have the new law on territory management. And also in 2016, we have for the first time, I would say, a very good law on social care services in Albania. But the problem with that, I will tell also later, is that it's not completed. The bylaws are not completed, which makes it unimplementable, let's say. While the spending of state budget has decreased from 0.32% in 2016 to 0.20% in 2020, it's a lapsus there, the spending in local budget has increased. So we see a spending in the local budget increasing. However, this increase is concentrated mainly in those municipalities, in the big municipalities, let's say in the wealthy municipalities. Transfers from the central government, so although we say that the primary responsibility to deliver services is from the local government, still the central government is the main source funding for municipalities. Investments are also very few and small in terms of social services in the municipality level. And the main cost driver, as maybe in other countries as well, accounts for the personal costs from 53 to 59%.
Emanuela,
now,
you have 2 minutes.
Oh, really? But what you have to understand is that Albanian social care system, it's composed of public and non-public service centers, and lately, since 2 years, also hybrid, collaboration. We still have residential and daycare centers, as I told, financed by the state and municipality budgets at the same time. We are in a reform, but the formula for the funding is not clear yet, articulated. So what you have to know, the problems are that secondary legislation for both local government law and social care services law are not yet completed. There is lack of costing for the services, financing and sustainability services. An important component is the social fund, which is supposed to serve to provide services. But this is a concept introduced in 2005. Finally, in 2018, it was made a decision to be formed. It has operated really few money for the services in Albania. Do we cover the needs? No, with the services. So both public and non-public sector does not cover the needs. From a study, and these are the figures that I'm sharing today with you are mainly studies of UNDP in Albania. The number of people with disabilities that get services in Albania by the state, by municipalities, from 18 municipalities out of 61 in total, is just around 2,000 people. So here you can understand what's the situation. Now, the problems of the pandemic have been the same as you counted all. So I'm not stopping here, but you have to know that there was no support for people with disabilities from the government during the lockdown or still, and no support for the NGO sector that provides services. So one of the questions here is how could EU help social care services in Albania? From this presentation, you would understand what are really the problems. Important thing is to push for the social efforts to be completed, financially help NGO services, and also building new services at the municipality level. So funding that targets both public sector and NGO sector. Also, it's important to mention, and this would be my last sentence, we have a national disability action plan for the next 5 years. There is a financial gap there of 47%, which means that this money should come from the donor community. Otherwise, this action plan will not be efficient. And it has not been efficient even for the last 5 years. And there is a decrease, important decrease in the budget from compared to 5 years ago, including minus 37% in the social care system. So there is a lot to do. And as I told you, to finish with a sentence from Austria, I have a son with Down syndrome and I live in Vienna. And since 2 years, I could not access any type of service for my son with Down syndrome. Private ones, there are a lot, but state ones, or maybe delivered from NGOs, I could not find in this country. So I suppose services are not a problem only for Albania, which is not a new country, but sometimes even for countries which are ranked as the best countries to live in the world. Thank you.
Thank you very much, Emanuela. And I think the last sentence means a lot. Throughout Europe, the issue of access to services, the availability of services continues to be a major issue, and in Austria and also in Albania. Thank you, Emanuela, for that overview. So now let's move on to a bit more to the east, to Bulgaria. Maya Doneva, you run Karandom, which is a service in Varna in Bulgaria. Can you let us know a bit about the financial situation of your services there?
Hello, Thomas. Thank you very much for the invitation. It's always nice to hear stories from different parts of Europe and to share with fellow ESPD members how things are going on. Long story short, as Thomas said, my name is Maya. I'm the executive director of Karindom. We are a foundation which generally supports children and families where children are with some kind of disability or with special education needs. It's been 25 years since we're doing this. We're one of the pioneers in the Balkans doing what we do. And the pandemic for sure hit us quite hard. It was very challenging, especially the first days, to actually realize that this is happening, and it is not just a movie scenario that we are starting to be part of, but it's actually something that we have to reshape all of the work we do, all of the individual therapy, all of the physiotherapy, because I mean, you could start psychological consultation online, but I'm sure that if you ask our physiotherapists, how do you actually do physiotherapy online? This is completely different story. So with us, I mean, the resilience, it was not only financial, but it was in a way that we also had to really reshape what we do and how we do it in order to survive in a way, in order to be able to support the people who rely on us. I have to be very honest with you. I hear that there's a lot of talk regarding what kind of support the EU is planning for the social service providers. Then I also hear our national authorities speaking about that, but as a social service provider, we have not felt this support in any way, not as a separate program that was open so we can be beneficiary of, not as any kind of subsidiary action or any, I'm sorry, but it's been a while already, it's been 1 year. So if that support was willing to happen to us, I think we should have felt it so far. So more or less to build upon what, in a very diplomatic way, Emanuela was saying, I think that there's not a lot to be done, but there's also not a lot that has been done so far, except of a lot of conversations regarding to identify our needs. We have identified them in a way, I mean, very clearly. Many of those needs are related to finances, and a lot of unexpected expenses that we as organizations had to deal with. And I mean, there's some of the expenses which are quite visible, for example, the masks, the hygienic products, the digitalization ones, which are a lot of investment was done there, especially in teams where digitalization was not a priority before. And in most of the social service providers, digitalization honestly was not a priority before COVID. So all of those expenses are the very visible ones, but there was also another separate part of expenses which we tend to like neglect a bit. For example, the mental health of the specialist, not only of the target group, because when we focus on our social impact, of course, we work a lot more, much more intense with our families and with the children. But then at the end of the day, our specialists actually were in need of mental support and mental help after this intense period. Bulgaria was one of the few countries which actually fully closed kindergartens, primary schools for very, very long periods of time. And in our case, especially in the Balkans and in the post-Soviet countries, the social sector is very much populated by women, especially women with younger children. So our specialists were wearing the two hats of doing digital consultation, first for external families, and then they had to go back to their own roles as mothers and as caregivers in their own contexts. So that was also very challenging on us as an organization, because in a way it also made a new line for support internally, not only externally. I'm doing all of this, maybe a bit longer intro, because I think that financial resilience is like the cherry on top, because if you lack the organizational resilience, you cannot really adapt at all financially and you will just disappear. For us, it was a huge challenge to keep all of our team so we don't lose anybody on the way of adapting and optimizing. Because
2 more minutes there, Maya.
We currently have 60 people full staff, which is a lot, and we cover 300 children annually. I would maybe use this platform just to say that if anybody really would like to support what the social service providers are doing, now it's really a good time to actually start doing it, and not to make it as a political statement, but actually as a community statement. Because I think if we as Europeans would like to stay sane and leave sane all of this, what is happening to us, we really have to be careful on how we are spending our money and how we are directing our money, because the social sector is a primary pillar of this society, and we need to have this as a mindset, not when there is only a crisis. Thank you very much.
Thank you very much, Maya. I think some strong but needed words there, and especially in terms of what I've heard over the last year, very much in line with how the sector feels, including from maybe a lack of support from European level. We hear about the money being available, but the money doesn't actually reach the sector. So thank you for sharing that view with us, indeed. So now I will move on to the next speaker, George from Greece. The floor is yours. You have 5 or 6 minutes. Thank you.
Hello to everyone. I'm George Retsos from Greece, from Estia. I have a presentation for you, but it's more targeted in the situation in our organization. Let me share my screen. Okay, so we are Estia. A few words about our organization. We're a supported social care center for people with intellectual disability. We're founded in 1982 by parents and friends of people with intellectual disability. We are overseen by the Ministry of Labor and Social Affairs, like other organizations in Greece with the same topic. Our service users are about 80 with mild and moderate intellectual disability, and our staff consists of 47 specialists. So we run several certain workshops, and we have a network of three supported living houses. We have three already running with almost 20 residents, and one that is we are preparing one more. So our annual work circle is about 102 million euros. The source of funding for STIA, and well, I'm taking the numbers that you're seeing is for 2020. It's coming from the state, it's coming from national and from financial programs, from the National Organization for Healthcare Services in Greece, from donations and events. You can see here a more graphical depiction of our funding. So during 2020, we have an income reduction of 4% and an increase in our expenses of 14%. How does STIA is running through COVID-19? The first wave during March and May of 2020, we were closed following the instructions of the Greek government, like other organizations like us in Greece. This was followed by an operation with 50% capacity during the summer, June and July of 2020. And we have no limitation to the presence of our service users since September of 2020. Yet we are obliged to implement measures of social distancing and during our daily operation. And I have to say that only 45% of our service users have returned to our daily programs due to their own reasons, mainly connected with the COVID-19. Another example of extra costs that we faced during the COVID-19 pandemic is that since November 2020, we had for our daily operation, we have to do mandatory. It was mandatory for us to do COVID tests in a regular basis, not only for our service users, but also for the personnel. At first, the cost for these COVID tests was covered by STIA. And then we have now the tests are implemented by the National Public Health Organizations without cost for STIA as for the tests themselves, but it still remains the cost that we have for the personal protective equipment, gloves, masks, sanitizations, and things like for our everyday use. Talking about our social care center, we have the funding for our daycare center. We can divide it in two main parts: from the National Organization for Healthcare Services, and the other part is from the implementation of the project under the Regional Operational Program in FATICA. In these cases, the cost is connected with the presence of our service users. We need for the money for the cash flow, we need to present facts of participation from our users. So you can see that a reduction to the attendance of our service users leads to a decrease in the revenue for STIA. The operational cost, of course, remains the same if it's not increased. And why do we have the same or maybe increased cost? Because we have, as I said before, increased needs for sanitary material. There are some overtimes by the staff so as to face the problems that appeared by the COVID-19. And another great part of what we did during the crisis is the digitalization of our services. We made a great effort to provide distant support to our service users. And this led us to purchase ICT equipment for the development of a digital platform for the indirect support of the persons with disability. And that led us to the creation of an online portal for our service users, which is still in need because, as I said before, only 75% of our service users are now attending our daily programs. I have to mention, of course, that there is a further decrease in the income due to the cancellation of a lot of fundraising events like bazaars. And this, there's some sort of compensation by an increase in the donations from companies, yet it's not totally compensated because I'm guessing that this is something that everyone faced. The donations from the companies, part of their corporate social responsibility plan, was very targeted to the impact of COVID-19 in social services. So the main problem for STI in our daily program is how to keep a smooth funding for our social care center. Talking about the
you have 2 minutes, George.
Okay, thank you. From the National Organization for Healthcare Services, we had no payment during the days that we were closed. And there are some attempts to compensate us for our operation during summer, which, if you remember, we work for the 50% of our capacity. The same, on the other hand, from the region of Attica, there are attempts to be fully compensated for our operation during summer, regardless of the proof of presence of our service users. These are on discussion, and we're not sure what is going to happen. And for the closing, I have to say that there is a common demand from our organization for a more concrete contract with the National Organization for Healthcare Services, not only for the daily programs, but also for the residential care units, because it will give us it will be an important step for our financial resilience. Thank you very much for your attention. The floor is yours.
Thank you very much, George, for a very clear overview, precise overview of how it's been for your organization, very close to the ground and covering many different details which are extremely relevant. So thank you very much. Joanne, thank you. I see that you have to leave, but thank you very much for joining us. And I will make sure that your presentation is shared with the participants afterwards. Thank you, Joanne. So before move on, so actually now let's move on to Portugal. Teresa, if you could tell us a bit about the situation in your country.
Okay, thank you. Good afternoon, everyone. I will share my presentation. Sorry. Can you see it?
Yes, we do.
Okay. So I would like to thank ESPB for this webinar and for inviting Humanitas to be here talking about the Portuguese situation. So Humanitas is a Portuguese federation that represents about 40 social providers for almost 6,000 persons with intellectual disabilities. Talking about the financial situation, and I'm talking before this corona crisis, social providers live on the limit of their financial resources. And there is a high dependence on state funding, very low contributions comparing with other countries in Europe. We also depend on families' payments, which are calculated on the basis of income per capita, but most of the supported families have low incomes, so we have low payments from the families. And we also have a great dependency on the donations, on fundraising. During the lockdown and since the last year in this COVID-19 pandemic, most of the families were allowed to pay less due to unemployment, layoff, reduced household income. So the family's payments reduced a lot. And since the beginning of the pandemic crisis, the contributions or donations are less and less. We can do actions and fundraising, so we are feeling also this reduced income. Incomes of social enterprises reduced a lot too. Some were forced to shut down, and these enterprises employed many persons with intellectual disabilities, which are now at home without a job. These social enterprises were also an important income in the global budget of some social providers. We also, at the same time, have increased costs with PPE, with technological equipment, computers for remote work, mobile phones to talk to the support to people and families, etc. And reinforcement of workers, additional staff at social care homes and residential homes. We feel a lot the absenteeism due to COVID and to isolation when workers have contact with someone infected as to miss the work. We felt that there is an effort of the Portuguese government to maintain the funding of the social providers, the social service providers, and there is some measures very important this time. One of them is Mares. It is a reinforcement of workers resorting to unemployed people. This is a temporary and exceptional measure which ensures the responsiveness of public institutions and the social sector with activity in the social and health areas, health services, hospitals, homes and residential structures for the elderly and people with disabilities. Another one is Adapter Social Plus. Through this program, an incentive system is created to mitigate the increased costs for restoring the conditions for the functioning of social responses. It supports adaptation of social facilities, changes in work organization methods, relationships with users, family members, and others, to the conditions that guarantee the implementation of COVID-19 contagious preventive measures to ensure physical distance, masks and sanitizer, hygienic equipment, reorganization of workplaces, etc. The maximum each social provider can achieve is 10,000 euros, but it is very little for the costs we have. Another measure is for the families, an exceptional support to families in the context of suspension of classroom teaching and non-teaching activities. This measure aims to protect household income and promote balance in the provision of family assistance for parents with children until 12 years old and families with a dependent with a proven disability equal to or greater than 60%. The government also ensures state funding 100% to all social providers in spite of being closed or with fewer users to support. It it has a guarantee of the funding equal to February 2020, when we were working with all users in a normal way.
Teresa, you have 2 minutes.
Okay, I'm finishing. What could be done? We think there are some projects need to arise, and one of them is special fundings to provide all families with technological and digital resources that enable rehabilitation and distance learning. Develop innovation transnational projects that make our hospitals, health service more accessible in communication information for people with disabilities. There is here a very lack of understanding. Develop transnational projects in psychological support for people with intellectual disabilities after and during the pandemic. For example, support for mourning, loneliness, anxiety, etc. And create new networks that allow people with intellectual disabilities to receive all medical care in their home or in residential home. And that's all. Thank you.
Thank you very much, Teresa. Again, an interesting overview also to see, but also interesting to see the differences between, for example, in Greece, where at the same period, struggling to get sort of the funds covered, whereas in Portugal, for when the organizations were closed, you got funded. But of course, the situation doesn't mean it's perfect either. And in terms of additional, let's say, ideas, measures for the future, I'm sure there's lots of options for maybe some cross-European projects that we can do to support you there as well. Thank you. So now we move on to our last speaker, Elena Vasiliou. I hope I pronounced it correctly. From Romania. The floor is yours. You have 5 or 6 minutes.
Thank you, Thomas. I'm happy to be here, and we're grateful for this opportunity. I will present a brief overview regarding the situation of our foundation, and I will start with a little of context regarding the intervention model of our foundation. Close to You Foundation is on a mission to change the life of people with disabilities, creating opportunities for work integration. We have developed 3 social enterprises, and at this moment we have over 80 employees, of which 18 are people with disabilities and 6 people are from vulnerable groups, mainly young people from the foster care system. Also, in 2019, we have become a grant manager for establishing 42 social enterprises in Romania, which are already active and will receive each a grant of 100,000 euros. Another ongoing project supported by the European Commission will allow us to replicate this model in the neighboring countries, Republic of Moldova and Ukraine. Regarding the COVID effects on our activity, they are stark, and we had to close the activity for 2 months, and people were sent in technical unemployment. The solution we have created were based mainly on offering psychological support to employees and to our beneficiaries, and also material support, which consisted in distributing free of charge over 1,200 masks. Regarding the government support for our activities, it is very limited. For our NGO, and especially for NGO, we didn't receive any support. We were not eligible for the measures proposed by the government, even if we had economic activity and paid taxes. 2 of our 3 social enterprises function as limited liability companies, and so for them we have received a grant for working capital. One is already being implemented and another is waiting approval. Regarding the support of the government for disadvantaged workers, Unfortunately, in Romania, for workers from vulnerable categories employed in social economy enterprises, there are no forms of support such as job subsidies. So, due to the pandemic, the most vulnerable people have been exposed to greater risk of losing their jobs and of not being employed. And regarding the specific actions that we have undertaken, we, together with the RISE, Romanian Network of Work Integration Enterprises, we have proposed a series of measures to be included in the National Recovery and Resilience Plan. And we hope to correct a number of issues, as work integration social enterprises have a very important role in creating job opportunities and supporting disadvantaged groups. So this is our brief overview regarding the effects of COVID on our activity.
Thank you very much, Lena. Again, quite a stark and difficult situation that you're experiencing. In particular, it's quite shocking to see the discrimination that the NGOs receive compared to for-profit enterprises in your country.
So for NGOs, there are no subsidies, no financial support in these times, just for limited liability companies.
Which is very shocking indeed. Thank you very much, Elena. We will also bring that message to the EU. We are approaching the end, but I wanted to ask each of you if you could describe in a few words. Next week, the Commission is launching the European Disability Strategy, and which will, of course, be for, let's say, the overarching framework for how the EU will tackle disability-related issues across the EU. If you had one message for them regarding the resilience of the sector, what would you say to the European Commission 1 week ahead of the launch of their strategy? So not major, if possible, if you could keep it just to a few sentences, but so what message do you have for the Commission? Emanuela, would you like to start?
Thank you so much. Well, I think it will most attack European countries. So I really don't know what to say, because also services are member state responsibility. So if we talk in terms of services, but I hope the strategy serves for a really a significant, really good measurable impact in the lives of people with disabilities, because over and over again, whenever we sit down and see, really there is few countries or maybe few places where somehow most of the needs of people with disabilities are covered. So let's hope for the best, and I would really more focus as ESPD and DAS to really keep the eyes on monitoring it. So this is also an important thing.
Thank you very much.
Monitoring implementation, I mean.
So measurable impact, not just words, and a role for ESPD in monitoring its implementation. Thank you very much. Maya, in Bulgaria, you mentioned already with the EU funds. What would be your main message?
Thank you. My main message would be that we need to see the sector as a partner, not as a problem, because sometimes I do believe that in the Balkans, we tend to see it in NGOs as a challenge to implement policies. And if we see them as a challenge, that maybe seems that the policies are not the right policies, not the sector. The sector at the end of the day represents the people and the citizens, maybe with less power to be represented. So I would really encourage the authorities to monitor how the civic sector is included in the decision-making, or if it's included at all.
Thank you, Maya. So, supporting the citizens across Europe who create services, who support other people, and the responsibilities that comes with. We need to make sure that we support them rather than see them as a problem. Thank you, Maya, for that. George, do you have any thoughts?
I think that the main problem it's on the implementation of the strategy. not only with the disability strategy, but with it's the same with all the strategies that the European Union is trying to work on. The problem is how the country states are implementing the strategy, and what is the role of the European Union so as to provide, so as to press the governments to depict to depict the positions of the European Union.
Thank you, George. So a stronger role for the Commission in pressing and pushing and encouraging member states to implement the disability strategy. Thank you for that. Now I'm going through the screen. Teresa, in Portugal, your country actually has the presidency of the EU right now. So what message would you have to them?
Well, I agree with the other speakers, the last speakers, what they say, but I think it's very important to have a network, a real network between social providers and policymakers. We will have a new challenge in a few months because people with disabilities, persons with disabilities are different in a psychological way. So families are different. Many activities and supporting were cancelled, and people stay at home for a long time. So I think there's a huge need to think about new projects and to think together, policymakers and social providers.
Thank you, Teresa. So keeping the relationship between the people we support, ourselves as networks, and then policymakers to recover from the crisis, extremely important. Thank you, Teresa. And last but not least, Elena, in Romania. Elena, what would you recommend?
Our message would be that we need functional solutions to the problems of people with disabilities and from vulnerable groups. And one very effective way is to provide subsidies for those organizations employing people with disabilities, because there are enormous costs related to employing people with disabilities, and especially in these times of crisis, the resources, the financial resources are very scarce, and we need subsidies, and we need programs and solutions to integrate these people. So
thank you, Elena.
Your message.
Thank you, Elena. Yeah, practical, functional solutions, not just words. That's coming up quite a lot. And subsidies for social enterprises or organizations employing people with disabilities. The good side is that the EU has a lot of competence over that. They regulate state aid policies. They have EU funds. There's a lot that the EU can do as well there. So hopefully that will be part of the strategy. Well, thank you very much to all the speakers for your intervention. Maybe last but not least, Sigrid. Sorry, I skipped you slightly there, Sigrid. What would you recommend as an academic?
I was thinking that the societies of the countries in the European Union are facing some fundamental challenges, and it concerns the question of how we want to live together, how do we want to support all kinds of different vulnerable groups and involve them in our society. You cannot leave the responsibility for all of this for the providers of social support services to cope in this very difficult situation, because we have another layer now through the COVID-19 pandemic on these fundamental challenges.
Thank you, Sigrid. So not leaving services to deal with, let's say, the issues at stake on their own, supporting them as best as we can. Thank you. Thank you for all those overview, very clear messages for the Commission. We will take that into account and make sure we pass them on to them. I know that several people from the European Commission are attending this webinar right now, so hopefully they're listening too. But now I will let the concluding remarks to Jim Crow, the president of ESPD. Jim, the screen or the floor is yours.
Thank you, Thomas. A comment by me is really superfluous in terms of drawing conclusions. I wish to give my heartfelt thanks to the panelists. You've all dealt very well with the constraints of Zoom and the constraints of this webinar in providing so much information to us in a very succinct and easily reusable fashion. It's so important for us. So please, thank you. We now have a strong view of the position in Ireland, in Albania, in Bulgaria, in Greece, in Portugal, and in Romania. We also have the support of the analysis provided by Sigrid Rand. This is so important that you know that we do use this information. We do use it with the Commission and with politicians in the European Parliament. And it doesn't make for wonderful hearing because the picture is so hard. But what is important is that all of you as organizations are continuing to fight to support the people with disabilities that you provide services to, and it's just incredible. You probably won't get thanks or gratitude from your governments or from your municipalities, but I'm sure you do get thanks explicitly and implicitly from the people you support and also their relatives and families. So I feel very humble listening to how you deal with these challenges. I would also like to thank our delegates who've taken part. Clearly they wanted to know and to learn from what's going on in other countries. And that doesn't always provide comfort, but it does help participants to have a rounded picture. And certainly, dear panelists, you've done that for us today. Rest assured, we will continue as ESPD to continue to draw this data and these difficulties to the attention of powers that be at a national level and across the Union and across broader Europe. It's not so easy to get them to listen even to us, but it helps us immeasurably having this hard data and information that you've shared with us today. And I know it's not always easy to find, so thank you very much for digging it up and giving priority to doing it alongside your day jobs. It's really very helpful. And there was just one final thing, and it's just not coming back to me. But we continue to speak up for you. The Commission, of course, has dilemmas because if they don't want to intrude too much on member states' territory or member states can get quite annoyed with the Commission if they believe that the Commission is intruding. But we'll continue to push the message that if being a citizen of Europe is to mean something, then you have to get access to the same levels of support and assistance wherever you are within the continent. It really is indefensible that the variations that apply, and so worrying that so many organizations, their funding needs are ignored by the states that they're located within. So I'll close by thanking the panelists, thanking Thomas and the team in ESPD for their work in putting these webinars together. There's a few people behind the scenes you can't see, but who help to make sure these webinars run efficiently. And thank you all, dear delegates and participants. Farewell.
Thank you, everybody.